Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we have a special treat. I'm gonna take you through a number of before and after transformations, helping people look as young as they feel. These are some gorgeous, gorgeous rejuvenation cases and some amazing outcomes. And I wanna share them with you in a compilation video. So sit back, relax, enjoy, and watch the show. All right, so let's go over this result. This is a pretty fantastic and pretty exceptional before with a really exceptional after. Most people don't age with this type of fullness, and in my beautiful patient's case, she actually had never had a neck and jawline like she has in her after. She's always had more or less genetically a full neck and more or less obscure jawline even when she was younger. So this is a very new look for her and one that's very welcome. But what's interesting here is, unlike a lot of techniques, I actually did not take out any submandibular glands or deep fat or deep muscles. What happened here is we took out the important yet superficial compartments, the excess fat, but what's really critical is that the entire facial and neck soft tissues were elevated more or less in a vertical direction, which then allows the jawline and neck to take on this very, very youthful and very elegant looking shape, and yet preserving some of those really important anatomic structures like the glands and the deep muscles and things that could potentially have issues for an individual later on. When the vector is in the right direction, the changes are very natural looking, as you can see here.
My name's Karyn. Today is post-op day 1.
All right, so we are here with Karyn. We're about to go into surgery.
Okay, today is post-op day 2. Today is post-op day 4. Today is post-op day 5. Today is post-op day 6. Today is post-op day 7. I'm Karyn. I'm 4 weeks post vertical restore.
Here I'm showing how the face ages. From the corners of the brow, the mid-face, jawline, and neck, everything goes downward. And the logical way to bring everything back up is to reverse this process. And this is what the vertical restore creates: a natural, beautiful facial rejuvenation by reversing the vectors of aging. So a lot of people want to understand how you can get such a big change and such a beautiful change and yet looks so completely natural. Well, the whole thing is based on the vector. You can see in the pre-photo, there's this jowling, this kind of laxity, a little bit of sagging around the corner of the mouth and heaviness in the midface and nasolabial fold. As everything is lifted in this vector, this upward vector, you can see that the jawline crisps up the mid-face kind of goes back up. And what is really notable in this outcome is that we also did a lip lift, which improved the proportions of the lip while we did a fat transfer to help augment some of the loss of volume along the pre-jowl area, as well as reinflate the lips and give it an all-around, more youthful, yet completely natural looking outcome. Beautiful, beautiful example of vertical restore, fat transfer, and a lip lift. When you're out, vertical restore, incisions are practically literally gone. And the ear anatomy looks amazing too. Beautiful. All right, my friends, I hope you enjoyed that. That is a small sampling of what we do every day to help people look as young as they feel. These results are incredible, and I thank every single one of our patients who have decided to share their journeys with you all to help inspire you and show you what's possible when facial rejuvenation and vertical restores are done right. If you haven't already, make sure you subscribe to the channel, see more videos from me, educational content, as well as these beautiful before and afters. And if you enjoyed it, make sure you hit like, comment, let me know what you think. Any questions below, feel free to ask. I'll answer as many as I possibly can. Until next time, Dr. Amir Karam.